Welcome to Cardiati's Clinical Department Core Lab Virtual Implantation Simulation. In this simulation, we are going to use the software created by Teremva for Cardiati's Endosize. And here we have the selected patient list in which we select the patient that we want to analyze. After opening the selected patient, we're going to have at our disposal the CT scan in Excel cuts as well as a 3D reconstruction of the aorta of the patient. In here, we can not only analyze the lumen and the thrombus formation in the aorta, as well as you can see the rest of the structures that can or not be affected by the pathology presented by the patient. The study involves not only the endovascular pathologies, but also the lungs and any other structure that, as referred, can be affected. The study of the 3D is as important as it is the study of the axial images. Therefore, we define points of interest to show the 3D. The P1 shows the beginning, in this case, in the sinotubular junction, the P2 and the P3 in the iliac arteries. These first points will give us access to know the extent of the lesion that we are studying, or the aorta. Afterwards, we go to the measurements page, in which we do all measurements of the aorta, the true and the false lumen in case of dissections, and in case of simple aneurysms, studying the diameter of the full aorta, so we have the idea of which MFM we need and how are we going to implant it. We study the measurements, the distances, and also we create a stretch line, a stretch view of the aorta, where we can see the whole pathology and the whole extension of the aorta without being compromised by the curves. And the left side, we have the most important points: the landing zone, the proximal landing zone, and the distal landing zone. These points is where the MFM virtually will start to be implanted in the proximal landing zone. When we go to the strategy phase, we're going to do the virtual implantation itself. We can select if any of the branches that will be covered have stenosis or not, the introducer side, the template with the measurements, and the catalog of MFM, so we know all the sizes. The process is simple. We add an MFM, we choose the correct side according to the diameter presented by the aorta, and we select the length that we want. After that, an MFM will be virtually implanted. In this case, we have to be careful with the curves and the kinks in the aorta. When we add the second MFM, it's very important that it's smaller in diameter, but that we won't be on the curvature, because the overlap, the minimal overlap of 50 millimeters or 5 centimeters can be changed according with the tortuosity of the aorta or any other specific cases when we need to increase or decrease the overlap. After the selection, in this case, we can select the third MFM to cover the full aortic aneurysm, always in a smaller size. The real implantation should occur from the distal part to the proximal part, so we can do it in a telescopic fashion by introducing the larger MFM inside the smaller MFM. We proceed to the report, the data that we will give to the patient, the distributor, and the doctor, in which they can see all the measurements, all the commentaries, and all the reports. This is virtual implantation by Cardiatis. Thank you.